Hey nurses, imagine you're in a busy community clinic and a provider hands you a prescription for a hepatitis B vaccine, but the patient mentions a yeast allergy. Do you administer it, or do you pause and question it? Today we're talking about vaccine contraindications, using the ADPI framework to ace this NCLEX-style case study. Let's sharpen your clinical reasoning and get you ready for the NCLEX. Vaccines are a cornerstone of preventative care, but administering them safely requires knowing when to hit the brakes. Contraindications, conditions that increase the risk of serious adverse reactions, are critical for nurses to recognize. This is huge for patient safety and a hot topic on the NCLEX. We'll use the ADPI framework to break down a case study and tackle an NCLEX question to boost your confidence. Let's get started. First up, assessment. In a community clinic, you're gathering data before giving a vaccine. You check the client's medical history, allergies, and current health status. For example, does the client have a history of anaphylaxis? Are they pregnant or planning pregnancy? Do they have a fever or acute illness? In our case, picture a client with a yeast hypersensitivity getting a hepatitis B vaccine prescription. You also note another client planning pregnancy in 6 months for MMR, and 2 others with DTaP orders, one with a family history of seizures, another with a latex rash. Key tools? Review the chart, ask targeted questions, and check the CDC's contraindication guidelines. Next, diagnosis. Based on your assessment, you identify potential risks. For the hepatitis B client, the nursing diagnosis might be risk for adverse reaction related to yeast hypersensitivity. Why? Yeast hypersensitivity is an absolute contraindication for hepatitis B, as the vaccine contains yeast components. For the MMR client, the risk is lower, since pregnancy is 6 months away, but you'd still educate on contraception post-vaccine. The DTaP clients, a family history of seizures isn't a contraindication, and a latex rash isn't severe enough to halt administration. Your diagnosis focuses on preventing harm by flagging true contraindications. Now, planning. Your goal is patient safety. For the hepatitis B client, plan to question the prescription and consult the provider. For the MMR client, ensure they understand contraception for 1 month post-vaccine to avoid risks if pregnancy occurs. For DTaP clients, confirm no severe allergies or recent encephalopathy. Prioritize clear communication with the healthcare team and patient education. A novel term here, contraindication, a condition, like yeast hypersensitivity, that makes a vaccine unsafe due to the risk of serious reactions. Time for implementation. For the hepatitis B client, you'd say, I'm concerned about this prescription due to the client's yeast hypersensitivity. Can we review this? You document the interaction and educate the client on why the vaccine is unsafe. For the MMR client, you administer the vaccine but teach them to avoid pregnancy for 1 month. For DTaP clients, you confirm no severe latex allergy or recent seizures, then proceed. Always double-check vaccine components and follow CDC guidelines to ensure safe administration. Finally, evaluation. Did your actions prevent harm? For the hepatitis B client, success means the prescription was revised and no adverse reaction occurred. For the MMR client, confirm they understand contraception instructions. For DTaP clients, monitor for mild reactions like redness, but expect no severe issues since contraindications were ruled out. Reassess by checking the client's status post-visit and documenting outcomes. Let's test your knowledge with an NCLEX-style question. A nurse in a community clinic should question which vaccine prescription. A. MMR, for a client planning pregnancy in 6 months. B. DTaP, for a client with a family history of seizures. C. DTaP, for a client with a latex rash. D. Hepatitis B, for a client with yeast hypersensitivity. The correct answer is D. Why? Yeast hypersensitivity is an absolute contraindication for hepatitis B due to the vaccine's yeast components, risking a severe allergic reaction. Option A is safe with contraception education, and options B and C don't involve true contraindications. Family history of seizures and a mild latex rash don't prevent DTaP administration. Clinical tip: always check vaccine components against client allergies. For NCLEX, if you see hypersensitivity and a matching vaccine component, think contraindication. That's a wrap, nurses. You've learned to spot vaccine contraindications using ADPI and nailed a key NCLEX question. Keep practicing clinical reasoning to shine on exam day. Don't forget to like, subscribe, and hit the bell for more NCLEX prep. Stay confident, and you've got this.